In line with Obesity Awareness Week 2024, we assess the intricacies of obesity management through the lens of the International Federation for the Surgery of Obesity's, IFSO's, latest report. We highlight not only the key findings of the report, but also the global efforts and challenges in addressing obesity. IFSO's 8th report is a testament to the growing global commitment to tackling obesity, with data from 480,970 metabolic bariatric surgeries across 24 countries. The report shows an increasing trend in addressing obesity surgically. The inclusion of new countries such as Azerbaijan, Iran, South Korea, and the United Kingdom marks a significant expansion of the global network against obesity. A striking revelation from the report is the predominance of female patients in metabolic bariatric surgery, a statistic that demands a deeper understanding of gender-related factors in obesity. The diversity in starting BMI indicates varied obesity patterns across different populations. The disparity is not just numerical, but is intrinsically linked to the prevalence of conditions like type 2 diabetes, which is more common in countries with lower starting BMI. The median age of patients undergoing surgery varies globally, from 34 years in Kuwait to 45 in Italy and the Netherlands, highlighting cultural and societal differences in the approach to obesity treatment. Preoperative comorbidities, with type 2 diabetes being the most common, reveal the complex interplay between obesity and other health conditions. Notably, males are more prone to conditions like OSA, hypertension, diabetes, and dyslipidemia, emphasizing the need for gender-specific approaches in obesity management. The report sheds light on evolving surgical trends, with sleeve gastrectomy emerging as the most common primary procedure, and Roux-en-Y gastric bypass leading in revisional surgeries. The rise in robotic surgery, especially in revisional cases, reflects technological advancements in medical procedures. Importantly, the safety of metabolic bariatric surgery is affirmed by the low mortality rates in most registries, underscoring the procedure's efficacy. As we focus on Obesity Awareness Week, the IFSO report serves as a crucial reminder of the global challenge posed by obesity. The diversity in patient demographics, surgical trends, and healthcare approaches across countries underscores the need for a unified yet tailored strategy in combating obesity. This global tapestry of obesity management, with its intricacies and challenges, calls for continued research, awareness, and collaboration to forge a healthier future for all. We are joined today by Professor Gerhard Prager, the new president of IFSO, to find out more. How does the gender disparity in metabolic bariatric surgery patients, with a significant majority being female, impact our understanding and approach to obesity management?
Yeah, this is, of course, a very fascinating question, because we face in metabolic bariatric surgery, where we look in the world, between 60 up to 80% female patients. Whereas when we look at the distribution of obesity, in some countries, we even have more male obese patients or people suffering from obesity than female. So the explanation is not entirely clear. One explanation could be that the self-body image of female people is different than in male patients. Saying that, very interestingly, those male patients that come to surgery suffer more from comorbidities than female patients, which means they come later to a sufficient treatment, in this case surgical treatment, than the females. And saying that, the consequence would be also to tailor the treatment specifically to the gender and comorbidities. So psychosocial factors also play a role in this context.
How does the prevalence of type 2 diabetes in patients with lower starting BMI challenge or support existing theories about obesity and also metabolic disorders?
So concerning challenging the existing theories, I would say BMI as a sole indicator is not the best, because we know that it is more the visceral fat mass, the waist circumference, that predicts the occurrence of diabetes. And furthermore, the metabolically unhealthy normal weight individuals do exist, which means that BMI alone is not a good predictor for diabetes, for instance. On the other hand, supporting existing theories, insulin sensitivity and fat distribution are supportive of the existing theories. And of course, we see a great variety in obesity itself. As mentioned before, visceral fat mass predicts the occurrence of obesity, whereas if you have a big amount of subcutaneous fat mass, this will be more in favor of having not diabetes. And of course, it is the most important thing if you undergo metabolic bariatric surgery is to do it at the early phase of your diabetes. Then you have the highest chance to get rid of your diabetes, to come into remission. Overall, almost 80% of patients suffering from diabetes undergoing metabolic surgery will go into remission. Not all will stay into remission, but it is fantastic to be able to revert the wheel of time a little bit.
If you wouldn't mind just going back a little bit and explaining just for listeners what sort of psychosocial means. So I think it's really fascinating that medicine is now looking kind of beyond just the sort of physical effects to the external workings as well. The sort of the complex interplay between internal workings and external workings. So can you just explain what psychosocial factors are and how they have an impact on obesity?
I give you just two examples. In Europe, the self-body picture of women is, of course, driven by commercial advertisements. So the picture of very slim female individuals is associated with health and well-being, which is, of course, not always true. But this might influence the burden on females suffering from obesity to seek effective obesity treatment at an earlier stage than males. On the other hand, statistically, obesity is associated with lower education and lower income. This, on the other hand, could also impact the accessibility to the healthcare system, depending whether you live in a country with a good public healthcare system, where the treatment is covered by the public healthcare system, or whether you live in a country where you have to pay yourself out of the pocket and you cannot afford because you have a lower income, which is the most likely situation if you suffer from a severe degree of obesity. Severe obesity is not a disease of the best educated rich people. It's statistically, at least in Europe and North America, a disease of lower income people with less education, unfortunately.
What trends in surgical techniques, particularly the increase in laparoscopic and robotic surgeries, are evident from IFSO's report? And what do they suggest about the future of obesity surgery? So, without a crystal ball to access, what does the future hold?
Yes, excellent question. So what we see now, laparoscopy is the dominant technique nowadays, and it is very safe. The probability to die from metabolic bariatric surgery is less than after gallbladder removal. Also, these are very complex or sometimes complex surgeries, and patients are at a higher risk statistically. So it's very, very safe. It is done minimally invasive. And what we see in the last years is an increasing trend towards robotic surgery, which of course will be the next level. We see this predominantly in the US, and now other regions in the world like Europe and Asia are gaining more and more robotic surgery. What else do we see? We see more and more endoscopic treatment options, which means even less invasive, no more scars. We do the whole procedure through the mouth, through the esophagus, a kind of endoscopic sleeve gastroplasty, where you make your stomach smaller without any incisions. And in this direction, we will see more and more in the future. We will see a combination of minimally invasive surgical options together with new pharmaceutical drug options.
Given the low mortality rates reported in most registries, how does the IFSO report contribute to the perception of metabolic bariatric surgery as a safe and effective treatment for obesity?
The risk of mortality is less than 0.1%. So these registry data from more of 500,000 of patients demonstrates the extreme safety of this most efficient treatment of obesity. And this, as I stated before, only metabolic surgery shows efficient long-term treatment of obesity. And obesity is a chronic ongoing disease. And with these data, we have large-scale data validation. So these are real-world data that are validated. And of course, it is also a message to the patient, not to make a big hurdle to the patient to undergo this type of treatment, but really to lower the threshold to have access to the most efficient treatment of obesity. Furthermore, I would say it also is a signal to the public healthcare providers to endorse this treatment, to give also people with lower income access to that type of treatment. In Europe, almost all the public healthcare providers cover metabolic bariatric surgery, which is of course not true for other regions in the world. But this of course could be a role model for other healthcare systems.
What are some of the key benefits of this particular procedure?
If I would have to summarize it in 2 sentences, I would say metabolic bariatric surgery is capable of extending your life expectancy. I give you an example. A patient with BMI 40 on average loses more than 7 years of life expectancy. And undergoing metabolic surgery, you can regain these years. Why? It lowers your risk of heart attack and stroke, and maybe most important, it lowers your risk of getting cancer. So lose weight, live longer.
Where can listeners go for more information, please?
I think most important, maybe our IFSO homepage. It's www.ifso.com. And from that page, you can jump to the chapters homepage for North America, Europe, Asia Pacific, and so on. And of course, we do have brother and sister organizations like the Obesity Society or the European Association for the Study of Obesity. There you can get further information. But I would say the first information you get from the IFSO homepage, ifso.com.